looks like we've got lots of people that have logged in here. So we'll get started. So we're very happy to welcome Dr. Diana McMillan, a registered nurse and associate professor at the College of Nursing, Rady Faculty of Health Sciences at the University of Manitoba, as well as the Clinical Chair, Research for Health Sciences Center. She earned her Bachelor of Nursing Science and Honors in Psychology at Queen's University, a Master of Nursing Science at the University of Manitoba, her Doctorate in Nursing Science at the University of Washington in Seattle, in sleep and pain, and was the postdoctoral fellow at the Mayo Clinic studying sleep in patients with advanced cancer. So we've got a very, very experienced person on sleep sciences here with lots of information to impart on something that, you know, we all spend a third of our life doing. So welcome, Dr. McMillan. Thank you very much for joining us here today.
Well, thank you, and thank you to Dr. Tanya Casera for the invitation to speak at the inaugural Wellness Institute speakers list, and also thank you to Darren Kachanowski for his very skilled IT support. So without further ado, I will get us started here. Sleep is certainly a topic that is near and dear in my heart, and while I am generally a very good sleeper, I have also experienced some times of bad sleep as well, and so I have great empathy, and it has certainly been an area of passion in terms of my clinical practice and clinical research. So today I want to talk a little bit about what sleep is, what regulates it, why we need it, and also to delve into some sleep strategies that we can all use to improve the quality and quantity of our sleep. And I've left time at the end to field some questions if you have them, and you may enter those into the chat box. Darren will keep track for me. So this painting that Henri Rousseau did back in 1897, entitled The Sleeping Gypsy, gives us a glimpse into what sleep is, and in many ways how strangely sleep has become part of the priority for our health. And I say strangely because in this picture you can see this gypsy appears to be lying down still, resting quietly with his, or sleeping quietly with his eyes closed, his musical instrument at his side, and he is completely oblivious to this large predator that is seemingly sniffing at his back. And from an evolutionary perspective, lying down without a really good idea of what is going on in the world around you, including safety hazards, and being still is probably a recipe for some disaster. And yet, we all sleep. All mammals need sleep, and if we don't get sufficient amounts of sleep, we actually become ill and actually can die. So it is really something that we are learning more and more about how important it is to our health. So what is it? Sleep is a reversible physiological and behavioral state. So unlike a coma, if someone is to gently shake you when you're sleeping, you would awaken, right? Somebody in a coma, that won't happen until they actually are able to actually move out of that coma. And we also see different physiological changes in terms of our heart rate and our respiratory rate, and changes in our brainwave activity. And we also see a change in our behavioral state. For this bat, that means sleeping upside down, amazingly enough. Other animals sleep half of their brain at a time, dolphins, for example, and I've just heard recently the geese do that as well, and they may be flying at night with half a brain awake and half a brain asleep. But for most humans, our behavioral sleep state is lying down. we sleep 2/3 to a third of our life. And this really should underscore the importance of sleep. I mean, the fact that we actually do this, even as adults, for a third of our 24-hour day is really amazing when we think of that sort of priority for this physiological and behavioral state. We know that there are two major sleep states: non-REM, which is composed of 3 stages, a very light sort of transitional stage where we just drift off into sleep, a slightly deeper slate of stage 2, where we see things called sleep spindles or bursts of electrical activity, and major sort of depolarizations of our brainwave activity. And also we move into stage 3, which is slow wave sleep, or also known as deeper sleep. And after about 70 to 90 minutes, after sleep onset, we transition into something called rapid eye movement sleep. And most of you may associate this with dreaming. Interesting little factoid for you is that we dream in non-REM sleep as well. But if I were to awaken you in non-REM sleep when you were dreaming, pretty much by the time you were able to actually speak to me, you would have known that there was a dream going on in your head, but it's gone. Like the memory of it has dissipated so quickly. Whereas in rapid eye movement sleep, our dreams tend to be much more vivid. We might see colors or hear sounds, or even have some smells that we integrate into our dreams. And if I woke you in REM sleep and you were dreaming, you might be able to describe the plumage on a wonderful flamingo quite vividly. We also see some things that are very classically REM sleep, and that is that there is a more irregular heart rate and respiratory rate, and we see surges in our blood pressure, and we have less control over our temperature. The biggest contribution to change, I guess, physiologically in REM sleep is protective paralysis. And this is a state where we have a real suppression of our muscle tone. So our extremities, for example, if I was to hook you up to an electrode, and I've done this in the past when I was a doctoral student, that I could tell when you go into REM sleep because the muscle tone of your arms and your legs is very, very low. Now, we do have some muscles, obviously, are up for respiration, and our eye movements, and we have these little saccadic eye movements that are still active, but by and large, overall, our muscle tone is suppressed. And this is protective, probably because we are having such vivid dreams. If we didn't have this protective paralysis, we could probably hurt ourselves or our bed partners. Now, we cycle through these sleep stages about 5 to 6 times over the course of the night. And as the other thing I want to point out as well is that the percentage or the amount of REM and non-REM sleep changes over our development. So in the green is wake time, and then the darker blue is REM sleep, and the lighter blue is non-REM sleep. And we have the newborns at the left side of the figure, and older adults to the right side of the figure. And you can see that, not surprisingly, newborns pretty much sleep all day. there may be about 6 to 8 hours or so where they're awake, but really it's not very much time. And we see a larger amount of REM sleep as opposed to when we get to about 10 years of age. That amount of REM has sort of stabilized to about 2 hours. And you can see a small decline of the overall sleep time, between becoming an adolescent to say when we're about 45, 46. And it really stays fairly stable after that, with at least minimally about 6 hours of sleep. I mentioned to you that we have this cycling through our sleep, and just sort of in this figure, the wake is at the very top, with the gold showing rapid eye movement sleep, and then those other lighter sleep down to the deeper sleep at the bottom of the figure. What you'll see here, interestingly, and this is just a snapshot of someone who probably went to bed close to about 10 o'clock or so and woke at 7 in the morning, you'll see that you spend more time in deep sleep in the early part of your sleep, and progressively more REM sleep, or those yellow bars, got a little bit longer as you move towards the morning. That's probably explains why it's more likely to awaken in the morning from a dream, because you're actually spending more time in that REM state earlier in the morning period. So I wanted to touch upon some factors that regulate sleep, and this will tie into how we can think about strategies a little later in the presentation, about how you can actually optimize this understanding to better improve your sleep quality and sleep quantity. So there's three main factors here. The first is a biological clock, which is called the suprachiasmatic nucleus. And that always makes me want to start singing Mary Poppins songs or something, I'm not sure. But if you know your Latin, supra is above, and chiasma refers to the optic chiasma. So there's a little bundle of nuclei that sit above the sort of crossroads of the optic chiasma. And really, it's like realty. It's location, location, and those bundle of nuclei are perfectly situated because that is where they're going to be in the direct path of light. And these nuclei are sensitive to light and dark, and they help to, this biological clock helps to entrain our circadian rhythm. And so we actually have a circadian rhythm that is not 24 hours, surprisingly, but a little closer to 25 hours. And I'm not sure exactly, we're still a bit mystified as to why that is. But what we do know is that we reset our clock on a daily basis. And so with our things like, having our breakfast and lunches and dinners, getting up to go to work, going to school, these kinds of things, they help to sort of entrain us back to a 24-hour rhythm. If, however, we don't have good light exposure, as is the case for some individuals who are blind, or perhaps, when you're not keeping to a good sort of 24-hour rhythm, you tend to drift. And so you may find that this rhythm sort of gets out of whack in a way, or if you've done any traveling, you may find it a lot easier to fly west than it is to fly east. And that is because staying up an hour later is actually in more alignment with your 24-hour rhythm. Now, why is this clock important? Well, the clock not only drives or helps to differentiate our sleep and wake rhythm, but it also drives other hormones. Growth hormone, for example, is almost exclusively secreted during sleep. And while growth hormone is certainly important for growing, so our children and older or young adults and teenagers really need that to make sure that they reach normal development, growth hormone is essential for all of us for tissue repair. So we all need to have a good amount of growth hormone, and to get that, we need a good amount of sleep, and particularly it's especially secreted during slow wave sleep. Other hormones that have a circadian rhythm include cortisol, and melatonin is another one that you, I'm sure, have heard about. It is a soporific, or it is a hormone that makes us sleepy, and it tends to rise just before bedtime, helps us to fall asleep and stay asleep in those early morning hours. So in terms of circadian rhythm, newborns have a more immature circadian rhythm. Teens are phase delayed. They tend to want to physiologically stay up late and sleep in late. And elderly tend to be phase advanced, more like morning larks. So as I mentioned, this circadian rhythm, or this suprachiasmatic nucleus, helps to entrain many other hormones and physiological rhythms. And I always liken this to an orchestra. So here we have this orchestra, and we're going to assume that sort of before them is standing a conductor, and they're all intently playing. And when they're playing a piece, say they're playing Beethoven's Fifth Symphony or something, they're not all playing exactly the same note every time. They're playing the same song, but not necessarily the same note. So the flute might come in, and you can see that the chap at the back with the cymbals, he's waiting intently for his cue. And when everybody comes in and goes out at the right time, this piece sounds wonderful. When they don't, it is probably, very chaotic and really just a cacophony of noise. And in much the same way, our circadian rhythm helps us to feel really optimally healthy and act, think clearly, be physically coordinated to the best of our abilities when everything is sort of in alignment and coming in or going out at their specific times. And it also means that if we're not having a good circadian rhythm, we're really feeling kind of out of sorts. So if we start at the bottom of the screen, that's midnight. We typically have our deepest sleep around 2 in the morning, very low body temperature around 4:30 in the morning, a sharp rise of blood pressure around 6:45, and our melatonin levels, which began around 9 at night, have really stopped so that we're not having any sort of carryover and sleepiness there. We probably need a quiet moment in the bathroom at about 8:30. Surge of testosterone is high at 9. Very high alertness at 10. I used to always try to do my hardest studying at 10 in the morning. And most coordinated at around 2:30, fastest reaction time around 3:30, and great muscle strength around 5, with a higher blood pressure in the evening and also higher body temperature. And then again, that melatonin starts to secrete and begins to ramp up to help us fall asleep and stay asleep. Now, the second regulator of sleep is something called, is a coordinator and a switch, and it's called the reticular formation and the reticular activating system, or the RAS. And for this to work, the way this works is that it takes information from your higher cortex, right? So as well as the input from the various nerves and sensory input from your body. So it coordinates this information, it takes this information, and what we see is that in order for you to be able to be in a state that is ready for sleep, you need to have both a calm mind and a calm body. So if basically you've got too much information, your heartbeat is pounding, maybe you've just gone out and run, or you've seen a terribly scary movie, or perhaps something is really troubling you and you're very upset, very unlikely that you're going to fall asleep, right? So you need both this calm mind and calm body, and that will help the RAS to sort of turn the switch and support you to fall asleep. The third factor is called the homeostatic drive, and that's simply that our need to sleep increases the longer we are awake. And the reverse is also true. So if we've had just a wonderful long sleep and really great quality, we wake up in the morning, it would be very hard for us to fall immediately back to sleep and have a good deep sleep, unless we're sleep deprived, right? So why does this happen? Well, we know that energy is depleted rather during wake. And so we have so we're sort of feeling some fatigue related to that. We also know that there is a buildup of toxins, one of which is adenosine. Now, sleep is a really complicated phenomenon, and so it's certainly not just a buildup of adenosine, which is the culprit. But interestingly enough, one very common adenosine antagonist, or sort of a blocker for adenosine, is caffeine. And so one of the reasons that caffeine helps us to sort of maybe have a temporary perk, feeling more alert, is that it may help to block some of the adenosine that is building up during our wake period. The other thing, though, that has been very, very interesting, and it's probably one of the biggest discoveries in sleep, I'd say, in the last 10 years, and that is they discovered a glymphatic system. Now, you probably have heard of a lymphatic system, right? Well, this is a glymphatic system, or channels that run deep into the brain. Now, these channels are closed when we are awake, and they are open almost exclusively, right, when we're sleeping. And what they do is they allow a perfusion of cerebral spinal fluid that deep into these brain channels. And in some ways, while we may have sort of a drip system during our wake time for exchange of the cerebral spinal fluid and nutrients and flushing of toxins from our brain, it's likened to a pressure washer when we're sleeping. So you have this wonderful perfusion of fresh nutrients and the removal of toxins. And so some of the work that I'm doing with colleagues in the ICU, for example, where patients often can develop something called ICU psychosis, may be related to this rather significant buildup of sort of waste material and a lack of fresh nutrients. And so sleep everywhere, but also in our ICU patients, is particularly important. So how much sleep do we really need? The National Sleep Foundation, which is a great resource, has this nice figure here. You can see that newborns need somewhere between 12 to 18 hours, and it sort of declines as we age to adults that need about 7 to 9 hours. And so while there is, as I said, about a 7 to 9 hour sleep optimal need here for healthy adults, that sleep need can vary quite a bit. So if you're stressed, or if you're down with the flu, any kind of health conditions, you'll find that you are going to need sleep more than those your regular hours. Genetically, we do see some contributions. So some individuals may have a slight predisposition to have shorter sleep and function really well. Most actually folks are running with a sleep debt. So they actually may need, say, 7.5 hours, and they're regularly getting 6 hours. And that debt can accumulate, and we'll talk a bit about some of those impairments in a minute. We also see that their circadian rhythm has an impact in terms of your sleepiness as well. So it's very common to be sleepy right after lunch, and not very common to be sleepy, say, right around 5 or 6 o'clock in the evening. The participation guidelines, which are Canadian guidelines, I'm delighted to say now integrate sleep into the guidelines as well as physical activity. So if you haven't had a look at those, I really recommend you looking at that. And they've got them for children and younger and older adults as well. So what are some consequences then of not getting the right quality or quantity of sleep? Well, I'm sure we've all experienced some fatigue, but in addition to that, even sort of an acute sleep disturbance, or sort of say you stayed up or had a very bad one night, um, you can see cognitive impairments, right? So you're not as clear in your thinking. Your memory may not be as good. We're not as good at task shifting. So this example of the street intersection is a really good one for reminding us that both acute and chronic consequences of sleep have that impairment. Why? We can regularly see individuals who either drove right through intersection because they really weren't alert, or they get to the intersection and they're not interpreting the street lights or directional signs like they normally would had they been rested. Motor impairment, we're a lot more clumsy, so we see more admissions to the emergency and urgent care, fractures, lacerations when folks are regularly sleep deprived or have a poor quality sleep. We see cardiovascular disturbances, so one of them being hypertension. And so folks, for example, who have sleep apnea, where they're having some occlusion or blockage of their airway or reduction of their airway, often have signs and symptoms that are going to be leading to hypertension or raised blood pressure. One of the things that we see very readily as well are mood changes. We become more anxious, not as good at coping, more emotionally reactive, and often more prone to depression. So getting a good night's sleep can really be helpful for our mental health as well. Hormonally, I mentioned the growth hormone. Another one that is altered or negatively impacted by poor sleep is insulin resistance. So we create, or develop rather, a state that is much like being a type 2 diabetic. When we are chronically sleep deprived, we have not the same optimal way of metabolizing our blood sugars. And so and they call that insulin resistance. So it's not working as effectively. And so if that is a state that is chronic, we are more prone to infections. So that's something, certainly as I work with my patient care providers and my patients, that is something that I'm alert to, as well as the growth hormone that are needed for good optimal tissue repair. Even for our tumble, roughened cell replacements that we need on a daily basis. And melatonin is not only a good hormone to help us fall asleep, but there's new evidence as well to suggest that melatonin is a free radical scavenger, which means that it kind of scoops up some of these free radicals which have been associated with the development of tumors and cancers. So we want that being in the appropriate levels as well to minimize those developments. We see immune changes, so we don't mount as an immune challenge as rapidly. So that means we're more prone to getting sick with whatever flu's going around. Poor circulation. So during slow wave sleep in particular, we have a really nice perfusion to our extremities, so our toes and fingers especially get a nice perfusion during sleep. And I mentioned about the glymphatic system. And while I was a doctoral student, I did quite a bit of work in pain perception and sleep. And what we see is that you can feel heightened pain for a given insult when you are sleep deprived. So that has implications for pain management, and unfortunately you can kind of get into a bad cycle of not sleeping well, feeling more pain, and then not sleeping well. So important to try to nip that in the bud. When we're tired, we also eat more than our energy requirements. And so one of the hormones that is impacted is ghrelin. And ghrelin, I always remember that it's the growly stomach hormone. So it makes you hungry. And we over-secrete ghrelin when we are sleep deprived, and we under-secrete leptin, which is that hormone that says step away from the table. And so we end up eating more than our actual energy requirements, and makes us more prone to gaining weight, which could then also in turn predispose us to greater risk for sleep apnea, because increased weight and sleep apnea are highly correlated. Not only that, but we want, when we're sleep deprived, we want to eat high fat, high sugar foods. And we are more emotionally vulnerable with poor coping capacity. So we tend to eat those comfort foods, which again are high carbohydrate tends to be. So these high fat, high sugar foods, more readily available than ever. And so one of the solutions that I readily suggest is to pre-pack and keep healthy, colorful alternatives handy, so that you, if you're feeling sort of vulnerable, can eat healthy foods instead of some of those maybe poorer choices. Now, COVID has really brought upon a number of challenges for us as sleepers. It's disrupted our daily life, which again contributes to this disruption of our circadian rhythm. It increases our anxiety and worry and depression. It's made a lot of us much more isolated. We've got a lot more stressors, both in our family and perhaps our work. And many individuals, we've seen reports, we have a lot more screen time, which is not great because it exposes us to blue light, which can suppress melatonin. So we end up having a stress-related fatigue, but not really a physically healthy and active related fatigue. And it may, and for quite a bit of the time, it disrupted our exercise routines. And I think one of the great things about the Wellness Institute is that it's, able to support you to get active and stay active, which is really, really important to keeping you into a good circadian rhythm and reducing that stress fatigue as well. And again, there's also the impact of COVID-19 virus itself on sleep. So, we know that good sleep can help us to cope and problem solve and stay physically and mentally healthier during the pandemic. And so there's research coming out every week, really, that is discovering new things about that relationship. So I wanted to spend some of the last bits of this presentation on how to take charge of your sleep health. And I've got a colleague who I quite delight in, who is a sleep clinician down in Denver. And he really strongly feels that he can just about cure anybody's insomnia by taking them on a canoe trip. And I do a lot of canoeing, but I thought I would put a plug in for him. Just, you're working, you're outside, you're getting fresh air, and you're sort of away from your busyness, perhaps, and stresses of your life, and it can really help to get you back in sync. So let's look at some other strategies as well. So it's almost impossible to fall asleep if you're really, really hungry. Now, I'm not suggesting at all that you have a large meal at bedtime, but you might need a very small snack if you're finding that a challenge, that you can't sort of sleep through the night without being hungry. Maybe half a banana, not too much fluids, because otherwise you may need to get up and go to the bathroom. Remember that reticular activating system in the RAS, we want to gear down so that we have this quieter mind and a quieter body. And if you're having trouble, you're lying in bed, you've tried to lie in bed for about 20 minutes or so, and you're not falling asleep, I would suggest that you get up and not spend very, inordinately long periods of time in bed where you're awake. So keep your bed for basically sleep and sex, and so that you're associating your bed with good sleep, instead of kind of getting anxious by the fact that you're actually lying there and you're not able to sleep. So getting up and doing something, maybe reading a short magazine in the kitchen or something until you're feeling sleepy again, would be a better suggestion. If you tend to nap, naps can be a good thing. Sometimes as we age, a 20 to 30-minute nap after lunch is a good thing. Certainly, it's an integral part of our sleep health for very young children. But I would keep that nap to a shorter period of time, 20 to 30 minutes. Otherwise, you reduce that homeostatic drive or that drive to sleep, and it may make it difficult to fall asleep and stay asleep at the time that you would like to in the evening. Keeping to a regular schedule, very important, especially a regular wake time. And wake time is probably the most important to help set that circadian clock, even more so than bedtime, but a regular bed and wake time would be ideal. And then you will be able to sort of entrain your body into a rhythm that will allow you to fall asleep a lot more easily. Careful with stimulants like caffeine, alcohol, and nicotine. While alcohol is a depressant and sort of makes you sleepy, it actually disturbs your REM sleep and it makes you get up to go to the bathroom. It's a diuretic as well, so it disturbs your sleep in that regard. And nicotine is quite a significant stimulant and causes you some sleep disruption in that way. If you're doing shift work, I do whole presentations on that, but support having a pre-night shift nap if you can, a short nap during your break safely on nights, and then making sure you've got about 15 minutes to sort of refresh and reawaken yourself, get over that sleep inertia before you take on your duties again, and try to prioritize your daytime sleep, but recognize it is certainly not as good as sleeping at night. Regular exercise, really, really important. And while if it's possible, if it's especially vigorous, to do that about 4 hours or more before bed. But what the research says is that any exercise, anytime, will actually support a better quality and quantity sleep. So if it's a little closer to your bedtime than you like, but that's the only time you can fit it in, I would actually still recommend that you take on the exercise. A warm bath or shower 1 to 2 hours before bed is also very relaxing. Try not to go to bed with wet hair if possible. And your bedroom should be quiet, dark, and comfortable, sort of like an oasis for sleep. Slightly on the cooler side if possible. And fresh linens and PJs, if you wear them. Sometimes folks find their toes are really cold, so make sure they're not sweaty. You might need to, wash your feet once before bed, make sure they're dry, and you might even find that wearing a pair of loose socks is helpful. One of the things I always encourage folks to do is this weekend, I would really encourage you to wash your linens, have a look at your mattress. When's the last time you've vacuumed it or flipped it? Does it look like a camel? Maybe it might be time to upgrade. You spend a third of every day on that mattress, so that might be something to think about. Wash all of that. Have a bath or a shower. Make sure that you've gotten some exercise and some sunshine, or at least out and walked around, perhaps maybe at the mall or something, to get some exercise that day. And have a bath and or shower before bed into fresh pajamas if you wear them, or at least a nicely fresh laundered bed, and you will just sleep so divinely. And you'll wonder, my gosh, why don't I do this regularly? And so I really encourage you. We all sweat and sort of perspire and slough off little bits of tissue, which add little bits of irritations to our linens, and we don't really appreciate that until we enter into a fresh bed. So try to get breathable sheets and wash your linens. I would say at least once a week, more if you tend to perspire. If you're perimenopausal, be particularly alert to caffeine and alcohol. This tends to exacerbate hot flashes. And so, having breathable sheets and clothing is particularly important if you're challenged with that. Bright light therapy, we can really benefit for in training our clocks with regular morning light exposure, and daytime bright light. If you can't get out and walking, even sitting and sort of reading the newspaper by the window can help on a regular basis. And if that isn't sufficient, and some people are affected by seasonal affective disorder, for example, there are bright light therapies, and certainly that's something for you to discuss with your GP or nurse practitioner in terms of some readily available strategies for things like seasonal affective disorder. Specific strategies during the pandemic, I can't enforce, more how important some semblance of schedule and routine is. The pandemic really sort of threw many folks for a bit of a spanner, or really disrupted our routines. And so getting back to some normalcy will help us with this rhythm, getting that wake time, gear down time, and bedtime, to get back into a normal routine if you haven't got that established or re-established already. Regular daylight exposure helps with the entrainment, and also the vitamin D, which we also know can be beneficial. And staying active, and so this is where the Wellness Institute can really help. With that, it, as I said, increases our healthy fatigue, reduces stress, and will really support us to be able to fall asleep and stay asleep much more effectively. Limiting that screen time, we want to make sure that not only we're optimizing that our endogenous hormone, or that our own excretion of melatonin, and that blue light in particular is the spectrum that suppresses melatonin. So we want to limit our laptops and cell phone noises, put them to silent mode if you possibly can. And practicing kindness for self and others, really important during this time. It's been a really long challenge. I think we've all, and this winter's coming back to wallop us apparently. And so, we need to be a lot kinder to ourselves and others, so that we can sort of end the day with leaving those worries and sort of maybe self-recriminations at the wayside, so that we can face the day, a new day, feeling much more rested. So fostering those safe connections help, and if possible, limiting news and social media right before bedtime if you can, if that is something that seems to be making you more anxious. And again, watching what you eat and drink. We've seen a real uptick in the amount of alcohol that is consumed by the population. Some other strategies. So the ones that I've just gone over are, that like getting to bed in regular times and having a cool bedroom and these kinds of things. These are non-pharmacological treatments, often called sleep health or sleep hygiene strategies. But in addition to that, in addition to those first line, those are always considered the first line if you're having difficulty with sleep. Try those. In addition, things like distraction or imagery, thought stopping, relaxation. I've read some studies recently on progressive muscle relaxation has been very helpful for folks with long COVID to help them fall asleep. Having a massage, pacing your activity so you don't become exhausted, but you're getting enough activity in your day. Meditation, mindfulness, and yoga, all of these things can help you. Again, think about that reticular activating system. What are the things that can help to give you a calm mind and a calm body, so that you can transition well into a readiness for sleep near your bedtime. Folks often ask about pharmacotherapies, and sometimes we do need some help with our sleep. Oftentimes, we may be struggling for one reason or another. I will say though that herbal medications, based on the major systematic reviews, there's not a lot of strong evidence to support a positive effect. things like valerian root, catnip. Who knew, right? Chamomile tea is a common one that's recommended. Now, you know, a nice warm cup of tea might make you feel sleepy, but the actual medicinal properties of chamomile are probably not going to tip the scale. Melatonin may be the exception. It is of some help in reducing the time to fall asleep. But again, I always say to use this with caution and discuss what and why you may be having some sleep changes, and try to determine whether there are you know, other health challenges that you have going on that may need to have further investigation, or whether there may be some other activity or de-stressing strategies that you might be able to use. So if you are reaching for over-the-counter medications, again, be careful. They should only be used on a short-term basis. And I really strongly encourage you to discuss any sleep changes you have with a care provider to make sure that you've ruled out what the underlying causative agents are there. Prescriptions, again, sometimes we do may need those, and they really should be done with consult with a care provider, and hopefully short term, and trying to address the root cause. So just to conclude then, I hope you're feeling that you've had a little bit of a glimpse of what sleep is all about and what is entailed in this rather fascinating and complex phenomena, and that you realize that sleep really is essential to physical, mental health, well-being, our learning, and our quality of life. And I hope that each of you are able to make sleep health a priority for yourselves and for your family. Not always easy, but it really has great benefits if you're able to try to do that on a regular basis. The other thing I want to support is that an active lifestyle will really support you to have better quality sleep. And so if that is something that you can, you know, sort of build in on a regular basis, it will have added benefits. Practicing healthy sleep patterns and behaviors really can make you feel, think, work, and play better, smarter, and safer. So I'm happy to take questions, Darren. I've left some resources here. The National Sleep Foundation has a great is a great resource. It's free. There's all kinds of information that you can find on their website. The Canadian Sleep Society as well has also great links to it, and Sleep Medicine is another really good website if you're interested in the topic. And so I will open it to questions. Thank you.
Thank you so much for such a fantastic presentation. So I will include everybody that's signed up for this. We'll get a follow-up email with a link to this video, and I'll make sure to include these links for everybody so you don't need to worry about trying to scratch those down right now. We did get some questions in, so I'd like to put those and get your opinion here on these while we've got you. One of them is, do eyeglasses with blue light protection actually protect you adequately? So is there a measurable benefit to using these, and is this something that could tackle dealing with that blue light close to bedtime?
Well, I think it would depend on the quality of the glasses, but there is significant evidence to support that they can help reduce that. So as I said, there's sort of a spectrum of light, and the blue light, which is a part of that spectrum, is the part of the spectrum that seems to be the enemy for us in terms of suppressing melatonin. If you are wanting to sort of look at your laptop and it's not too distressing or anxiety provoking maybe in the evening, but you want to not suppress your melatonin, then yes, trying those glasses with the blue light sort of film screener or whatever might be a really good good opportunity to do that.
Yeah.
You can also set your laptops to sort of a sleep mode, which reduces the light overall, which is helpful as well.
Yeah, both PCs and Mac have that option to kind of a warm light or evening light option in there, so you can go and check the options in your computer there for sure. Well, that's good to know. Oh wow, lots of questions coming in. So here's the next one. Is it okay to read in bed in order to fall asleep?
So yes, actually, it can be really relaxing. It's just a matter of what the choice of your book is. So if a Stephen King thriller is going to keep you up half the night, you might want to, switch it up a little bit. But
Yeah.
reading can be a great idea, and in part because it can remove you, it can transport you from sort of maybe the more challenging thoughts in your day, right? And
Yeah.
so it allows you a break. And so it can be a really great thing to do regularly before bed, so long as you close your book and turn your light off.
Okay, sounds like a good pointers there. Do you need to completely cut out caffeine? Or is there a time of day where you should be saying no more and I'm off it at this point?
Good question. And it is really, it's generally recommended that you could have caffeine in the morning, but not, after lunch, right? Now, that said, some individuals have a great sensitivity to caffeine. So it's kind of one of those things that it's very individual. And so I know some individuals who really can only have 1 cup of coffee first thing in the morning. If they have 2 cups of coffee in the morning, they have challenges. So
They're that sensitive to it, eh? Yeah.
they're that sensitive. So it really is there's a bit of a variation there. But if you're finding it hard to fall asleep, certainly, maybe going to decaf, or really, making sure you're not having anything after breakfast, and seeing if that helps.
Yeah, yeah, that makes sense. Now you kind of touched on this a bit, but does taking melatonin really help with one's sleep?
Well, it helps a little bit. So maybe. So how's that for qualifier? So for some individuals, let's say for example those who are traveling or shift work, they found that has been helpful to help people, fall asleep maybe if they have to, work nights and they're trying to sleep during the daytime. And it seems to reduce the time to fall asleep by maybe 15 to 20 minutes, maybe 30 minutes. But it has varying effect on necessarily, helping you. It's not a cure-all, I don't believe, for
Yeah,
having a great sleep overall. And
it's
and
not
the
like
thing that I
a script
always
that your doctor would give you that's more intense that would have a more dramatic effect, is what you're saying.
True, but I guess what I'm saying is that for some people, it's the falling asleep that's the challenge. Once they fall asleep, they're good. So having that little boost is helpful. But what can you do to actually, first, before you sort of turn to that, what can you do about your routine, about gearing down, about getting more exercise, that would even be even more effective? Because there seems to be, variable effects with melatonin or other over-the-counter or even prescriptive medications. And I always wonder, what is the underlying change or problem to your sleep, and how might we be able to address that better?
So it would be a more productive use of looking at those options rather than having the meds be your first stop. Hey, that makes
So
sense to me.
always sleep health or sleep hygiene things like the, cool, dark, quiet bedroom, maybe one of those white noise generators, dark curtains, get your TV out of your bed, maybe take your pet out of your bed. I'm sad to say, but some pets can jump on you in the night. So, those kinds of things all really should be explored first.
For sure, for sure. Um, why are doctors so concerned about medications that increase GABA activities? If they are working and are not increased demand, why stop them? I'm not 100% sure on this one. So why? GABA activities. I'm not even sure what that acronym means.
GABA. Well, you know what? That's a great question. It's probably one I would try to tackle offline. If somebody wants to send me an email, maybe I can send you some information a little bit about that. I think health providers, your physicians, your nurse practitioners are trying to, sort of balance competing priorities. And so we're a very complex electrical chemical soup. And so navigating that is a challenge. And so I know it's something that our medical teams and care providers are trying to do the best. And I don't have a specific answer for your particular question
Yeah.
offhand that I can give it a 30-second caption.
No problem, no problem. All right, well, let's keep moving on here. So if you feel sleep deprived, is it better to nap or stay up as long as you can? What about being overtired? Can you be overtired and have that stop you from getting a full night's sleep?
Okay, good question. Generally, what they suggest is if you're able to get back to like your regular bedtime that night, so
Yeah,
say you're feeling overly tired today,
yeah,
but you have regularly had a trying time falling asleep, right? So it's not that, so you regularly have sleep challenges falling asleep. It's
okay,
better not to nap and try to get to bed at, a good hour, like 10, 9:30, 10 o'clock, right?
yeah.
Um, or if you really feel that you just can't do it, set your alarm immediately after this talk for 30 minutes and have a
Yeah,
nap and actually get up and then go for a walk afterwards. Because what you don't want to have is that you're napping too long or too close to bedtime. You reduce that drive or that homeostatic drive to sleep, and then you're wide awake at bedtime and like, oh, that darn McMillan, she was telling me I could have a nap, but now it's 3 in the morning, right? So
yeah,
you want to try to, if you have hard time with insomnia, you try to cut out naps entirely, and when you're starting to feel sleepy, go for a walk. If it's a sort of a one-off thing, have a 20-30 minute nap, and make sure you get up right afterwards and
yeah. Don't
not
overdo it.
early
Yeah.
after lunch. Yeah.
Yeah. Okay. Well, that makes sense. So we've got a couple questions on this topic. Besides no liquids 2 to 3 hours before bedtime, do you have any suggestions for minimizing nighttime interruptions?
Okay, so that's a good one. So first of all, try to put your cell on silent mode. Lots of people interrupted by their cell phones or beeping with their laptops and things like that.
Hmm.
I actually recommend strongly moving your television out of your bedroom and also your tax papers or whatever, anything else. Like make your bedroom an oasis for sleep, basically. So there
Yeah.
shouldn't be anything in there that's stressful. Keeping it cooler, dark. You may need to get darker curtains if you find the light is bothering you, whatever. Those noise, a fan or a noise generator, or even some of those, there's apps that can sort of have rippling water or rain falling, whatever, that can be helpful.
Yeah. Like
Um,
a white noise.
yeah, and if you have other other members in your household who are staying up, we'll have a conversation with them about the fact that you need to get some sleep. Maybe they need to turn their music down or negotiate a little more thoughtfulness there.
Hmm.
And if you have pets, I really have a consider, is your pet making it harder for you to breathe, or are they disturbing you? Is it time for them to get a nice bed in the living room as opposed to, pushing you out of your own bed. So
Yeah, so
yeah,
minimizing all these external factors as much as you can. I mean, you can't do much other than stopping drinking a few hours before, but take care of the things you can control and flex those as much as possible to kind of hedge your bets there, hey?
great. And if you're, say, if you have a bed partner and they're having problems with sleep, restless legs or periodic limb movement disorders, these are sort of things that can occur, sleep disorders that can happen, or they're snoring or whatever. Bad sleep in one member of your family means that everybody in your family's not sleeping
Yeah,
well. So it really is important for everybody to be in their best health and their best mood and the best coping. That if somebody in your household has got sleep problems, that you go and see, if it's more than just a couple of weeks kind of thing. If this has
yeah,
persisted for, say, 3 months or
yeah.
even 2 months acutely, go and go and see your healthcare provider about it. You may need to get a more thorough assessment, and people can offer you, some assistance with that.
Some
It's not something
alternative
you.
specialized care. So there's not always a one size fits all solution for everybody. And sometimes you really need to get the specialist in there to look at your case individually, hey?
That's absolutely true. So we're all individuals. We have individual health challenges, and that means that we, can benefit from some general strategies that I've covered today. But it
Mhm.
also means that we shouldn't leave problems go. It really has a huge impact. And one of the curious things about having bad sleep is that it we often don't know how tired we are until we've had a good night's sleep, and it's like, wow,
And you can
this is
measure them.
yeah.
Yeah, and you can kind of relate it to the exact opposite of a bad sleep, which is a good sleep. So I know we're running short on time here, but I got another one here. Um, what about alcohol with dinner? Should you stop alcohol intake before sleep? What is kind of like a cutoff time for the effects of alcohol and making sure you don't affect your sleep?
Okay, good question. Well, as I mentioned, alcohol it has some sleep disturbing properties, particularly REM sleep. Um, and it also is a diuretic. So, which means, you'll have to get up to go to the bathroom in the middle of the night, which is sleep disturbing. So having, say a glass of wine at dinner, if your dinner isn't too late, right?
Mhm.
Um, probably won't have too much of a negative effect. But it is, again, individual, right? So if you had a lot of fluids, including maybe a couple of different glasses of wine later, closer to bedtime, then you'll likely be finding that you're getting up in the middle of the night, or finding that you're maybe having hot flashes that waking you up. So,
Mhm.
I guess my advice is, if you're having more than one glass of whatever alcohol, and there's varying content to the beverage of choice, and you're having sleep problems, then try cutting it back and try just making sure that it's closer to, say, 6 o'clock or whenever you're having dinner, as opposed to 9:30, 10 o'clock. Now,
Right.
if you have some flexibility and it's a nice occasion or whatever, and you don't mind having one sleep disturbed night, it's not a big deal. Well, then celebrating is not a bad thing either, right? But to moderation. But if it is a challenge for you, and you really need to be sleeping well, or an alert, then that's something you need to weigh, and probably cutting back, or finding. They've got all kinds of beverages now that have much lighter alcohol content,
Yeah.
which would probably help support that as well. Both
Yeah.
wine and beer, actually.
I guess yeah, it all just follows down to moderation and knowing yourself and I guess that's been a common theme through a lot of these things, these answers here. Um, so I think that's where we're gonna wrap it up here. I really appreciate you running through this stuff. Everybody who's signed up for this webinar, you'll get an email after the fact with the links. You can come in and refer to this presentation again. It'll also be available on the Wellness Institute website. But thank you very much, Dr. McMillan, for joining us here, and your expertise is greatly appreciated. And thank you so much for speaking with us here today.
Well, thank you, everybody, and appreciate your attention and great questions. And I hope everybody has a good night's sleep, and work on that. You'll feel better, and it's something that you can do by increments. So it may not be all at once that you improve, but small steps can really tip the balance. So thanks again, everybody.
Awesome. Thank you very much. See y'all later. Have a great day. Bye.